Good night, friends. Mr. Lochan here at the lab, Medical, Scientific and Community Support Services. I'm here just performing some laboratory tests, and I came across some results that I think might benefit you, benefit all of our patients and our population as a whole. We know that your clinicians would request laboratory tests for you based on what your signs and symptoms are, based on if it is just to check routine health. But there is a test amongst the several hundreds of laboratory tests. There is a test called the ESR, Erythrocyte Sedimentation Rate. ESR, Erythrocyte Sedimentation Rate. It is a non-specific test in that you know how you can check someone's cholesterol and know that their cholesterol is high or normal, or you can check somebody's blood sugar and know what their sugar is. The ESR is a blood test that essentially puts a patient's blood cells in a long tube, and then that tube is kept upright in a vertical position and left to settle. That red column you see in there, those are the red cells. But the normal rate of settling is 10 millimeters for a male and 20 millimeters for a female that I have allocated here with a pink mark. Look how elevated this patient ESR is, erythrocyte sedimentation rate. One is close to 130 and the other one is 100 millimeters in 1 hour. Basically, they put the blood in a long tube, kind of like a straw, and then it is left for 1 hour in a vertical position to settle. The rate at which the red cells settle is an indication that there could be issues with respect to inflammatory conditions, infections, autoimmune disease, like rheumatoid arthritis. It could be even anemia. It could be some instances of thyroid disease and even other medical conditions. As a matter of fact, the ESR is such an important test that many clinicians request this quite regularly on their patients to see how their patients are progressing. All right, a high ESR is indicating that there is a general state of illness, but it is usually elevated in autoimmune conditions, in inflammatory conditions, and some other medical diseases as well. So I want to just introduce you to the ESR, and tonight we have two very abnormal results. It only supposed to settle, the red cells only supposed to settle where my finger is moving here. All right, just thought I'd show it to you. Forgive the quality of the recording, but we just like to keep it real and show you. ESR, the erythrocyte sedimentation rate. E for erythrocyte, your erythrocyte, or some people say erythrocyte, it is your red cell. Your leukocyte is your white cell, and your thrombocyte is your platelet. All right, keep well, take care, and if ever you come across your ESR, normal range for a male is 0 to 10 millimeters in 1 hour. That's just at the top. And for females, 0 to 20 millimeters per hour. Higher ESRs than that is an opportunity for your clinician to be mindful that your existing medical condition might not be as in a good place as you might want, or it could also help with the identification and diagnosis of other medical conditions. All right, keep well. Mr. Lochan here at Medical Scientific.